Siddha medicine, we would like to see some basic informations about the strep throat. So, what is strep throat? Strep throat is an infection, that is a bacterial infection of our throat and the uh, lymph node, that is tonsils, back of your mouth. So, with the strep throat, the tonsils, throats become very inflamed. This inflammation typically affect the surroundings of the throat and other uh, adjacent part of the throat. This is called a sore throat or pharyngitis, also called as sore throat or pharyngitis. So the main cause of this disease is purely bacterial infections. So, strep throat gets its name from the typical bacteria that causes it. That's a group A streptococcus, that is a GAS, in the short name GAS. Group A streptococcal infection. There are more than 120 strains of group of streptococcus bacteria infected human being. So the mode of spread is also very similar to that previous cold and flu. That is the respiratory droplets. When someone strep throat, cough, sneezes, talks, laugh, or singing, the release of droplet containing the bacteria spread through the air. Direct contact with the persons, like touches, the nasal secretions will spread to the others. The third one is that touching the contaminated surface. So drinking, sharing the cups, plates, glasses, and touches the surface, those who touches the infected persons are transmitted through. This three is the major spreading mode. That is respiratory droplets, direct contact, touching the contaminated surfaces. These are all the three major mode of spread. And what are the other risk factors? The mainly age. So anyone get the strep throat, but the some factors increases the risk. The mainly the age and the immunosuppressive state. So most commonly, children at the age of 5 to 15 years old is more vulnerable. It is very rare children younger than 3 years. So close contact with another person with strep throat is the most common risk factor for the illness. So age is also very important. So if any age can affect. The most common is 5 to 15 years. So these are all the some symptoms. Early strep throat symptoms includes sore throat that starts suddenly, sore throat and inflammation of the throat. Other symptoms are the fever and rigor, that is chills, severe headache, loss of appetite, abdominal pain, nausea, and vomiting. These are all the other um, major symptoms of strep throat. This is very important to note that an uncommon symptom of strep throat is a cough. If anybody have the cough or other cold symptoms, you probably may have with the other infections, other viral infections, that is a non-strep throat infections. In addition, some people with strep throat may not develop any of these symptoms, only throat pain. So these are all the complications of the strep throat. That is abscess. Abscess means that there's a pus pocket around the tonsils and neck. The second complication is the ear infection. The third and fourth is very the serious infection, serious complications of the strep throat. The first one is the glomerular nephritis, that is a kidney disease, kidney infection. The second one is the rheumatic fever. This affect the heart, joints, and brain. So after the streptococcal throat infection, the autoimmune reactions and other antigen antibody reactions, other organs will affect the mainly the kidney, heart, and joints and brain. These are all the serious complications of the streptococcal throat infection. The next complication is the sinus infections. After the throat infections, the infections spread to the sinus. So management is very we are going to discuss the very simple homemade preparations and the simple Siddha preparations only. If you have any doubt regarding this strep throat, we will discuss after the meeting over. The first simple thing is the clove, that is krambu or lavangam in Tamil. The important thing is we remove the pulpy part, that is a muddy part, that is the upper part of the clove we need to remove, even we use it as a culinary purpose. So for the culinary purpose or tooth powder, we remove the upper pulpy part, that is a muddy part. We remove the part, and the sticky part, we use it as the remedy as well as the culinary purpose. So roast the clove with small quantity of ghee, and we use it as the lozenges. That's a chew the water, that is water salivary content after soaking it in the oral cavity. Swallow it in a very slowly. It soothes the throat. This is the very good remedy for the initial symptoms of the strep throat. The second one is the fenugreek tea. So 1 teaspoon of fenugreek seed mixed with 300 ml of water and boil until the liquid reduces to 150 ml. So two way we are using with the fenugreek tea. One is the goggling, swishing 50 ml of that water with the goggling purpose, and then after goggling we drink the remaining portion of the 100 ml. We can mix with small quantity of dry ginger powder and honey or palm jaggery, or we can mix with some tulasi leaf or some herbal powder also with this fenugreek tea. So the fenugreek tea is very effectively control the symptoms, as well as it has some antibacterial effect. It removes the bacterial infection of the upper respiratory tract and the lungs. The second thing is licorice tea. In Tamil, it is called Adimaduram. In Sanskrit, it is called St. Madhu. So 1 teaspoon of licorice mixed with a half teaspoon of dry ginger powder and boil it with the 300 ml of water. Reduce it to 100 ml. 1/3, that is the final product we get it is the 100 ml. 300 ml reduced to 100 ml. And filter it if you really need some more sweet. That is a licorice itself has some small sweet taste. If you need more sweet, we can add some palm jaggery or honey to this licorice. Drink it twice or thrice a day. Will remove the symptoms as well as remove the infection of the strep throat. We can also use the small cut pieces of the licorice as a lozenges. So mouth ulcers, throat ulcers, gingivitis, dental problems, and some other upper respiratory tract infections is controlled very effectively controlled by the licorice. அதிமதுரம் சூ பண்ணி சாப்பிட்றது, சும்மா வாயில் அடக்கிக்கிட்டு கொஞ்சம் அது சூப் பண்ணாச்சுன்னா அது இந்த த்ரோட்டுக்கு ரொம்ப ஹீலிங் எஃபெக்ட் இருக்கும். ஸோ தி licorice tea is next homemade simple preparation. The another one is the cut pieces of garlic. Soak it in a honey for at least 20 minutes and chew the garlic with the honey will heal the tonsillitis and the strep throat. So the cut pieces, the freshly prepared these preparations will remove the throat infections. Next lozenges is the three ingredient we have mixed to the three ingredients. The number one is the cardamom, elakai, dried ginger, chukku. The third one is the cumin seed. So 10 cardamom, 10 grams of dry ginger powder, 5 gram of cumin seed powder. So mix together. We add palm jaggery as per the taste of each of a patient, each of our relatives or any children in our make it as a small ball, or we can take half teaspoon of this powder, chew it slowly. This is very effectively control the upper respiratory tract infection, and running nose as well as the headache and migraine also controlled with this lozenges. Mainly strep throat. So next homemade preparation is a herbal tea, star anise seed drink. Roast the star anise seeds with the pepper and cumin seed. It is equal quantity. Grind it very grind it coarsely. So the combination of these three preparation, 1 teaspoon mixed with 500 ml of water. There is 1 teaspoon of this powder mixed with 500 ml of water. Reduce it to 125 ml. That is 1/4. Reduce it to 1/4 and mix it with the palm jaggery. Drink twice a day. Will get a better results. So all these three ingredients has antioxidant, antibacterial, anti-inflammatory effect. So it is the immediate effect can occur after drinking this star anise seed drink. Some at least 10 to 15 herbal powder is advised, indicated for the strep throat in Siddha system of medicines. We highlighted here 4 herbs available in US and all over the world. The first one is the Ocimum sanctum, that is a tulasi. The second one is the mint leaf. The third one is the Thuduveli. Solanum trilobatum is the botanical name, Thuduveli. The fourth one is the Nochi ilai, chash tree. Just it is available in the US. Just easily grow it in a US land. So these 4 powder, these 4 herbs are useful for the strep throat. How do we use? So simple. There is all the powder. If you have the shade dried powder of each one of the herbs, for example, tulasi leaf, 100 gram of tulasi powder mixed with 15 gram of pepper powder, and with this mixture, that is 100 gram of tulasi powder and 15 gram of pepper powder, take 1 teaspoon mixed with ghee or honey twice a day. We can prepare this herbal powder with any one of these powder. We can choose Thuduveli, we can choose the mint leaf, we can choose the chasqui tree leaf. There is a Nochi ilai. All these herbal combinations have antibacterial, antiviral, antioxidants, immunomodulating effect. So it also useful for the prevention also. In the winter seasons, we can prepare it any one of the powder and take once a day for prevention, twice a day for the treatment. For prevention, take 1 teaspoon. For the treatment, twice or thrice a day, along with ghee or honey. So things to avoid is also very important during the treatment, during the prevention. So milk, curd, some milk products. So butter, curd, milk, we should avoid. You all well known about the white sugar and the table salt. So we can use the sea salt, but avoid table salt. Sea salt gargling is very common for in our families. So lukewarm water mixed with the salt water, gargling is effective, but we should avoid the table salt. Spicy foods we need to avoid. That is, it irritates the throat. So crunchy and hard foods also very increase the inflammation of the throat. So caffeinated beverages. So these are all the things we need to avoid. So we are also going to see some simple Siddha preparations. Safe Siddha preparations are Talisadi Vadaham. It is available in the US market also. This is very effective treatment for the sore throat, running nose, nose cold, fever, headache, migraine. So one tablet of this Talisadi Vadaham, chew every 3 hours during the symptomatic conditions. If we use Talisadi Vadaham as a preventive method, take one tablet twice a day is enough, morning and night. The next preparation is 3-headed Churanam, the combination of dried ginger, pepper, and long pepper. Chukku, milagu, tipuli. Equal quantity, powdered and mixed with, we can use mixed with the palm jaggery or honey. It is very useful. In this strep throat, this 3-headed churnam, half teaspoon with half teaspoon of tulasi leaf powder and honey. Take twice a day. It is effectively control the symptoms and effectively remove the toxic material present in our body, mainly the bacterial infections. Swasakudori tablet is a prepared medicine. It is also safe. The Swasakudori tablet is available in the Indian market. It is not available in the US market. We can store it or buy it from the India. 2 tablets, chew with the betel leaf and honey. Vetrillay, 2 tablets. So 2 tablets mixed with betel leaf and honey, chew twice a day will reduce the symptoms of the strep throat. The fourth one is the Adadodai Manapahu. Adadodai is the Adadora vasica, that is a herb. Prepare out of it is a Adadodai Manapahu. It is a prepared medicine. 15 ml of Adadodai Manapahu mixed with the lukewarm water. There is a 50 ml of lukewarm water, mix it and drink it in a slow manner. Will remove the symptoms of the strep throat. You all well known about the decoction, the Nilavembu decoction, Nilavembu Kudinir. So 1 teaspoon of Nilavembu decoction powder mixed with 250 ml of water and boil it and reduce it to 60 ml. Twice a day is effective. We can use this Nilavembu decoction as mouthwash. There is a gargle or swishing with the Nilavembu decoction and also useful for removing the symptoms of the strep throat. The last one is the Toothville Lehium. It is very good immunomodulating elixir. According to Siddha system and the recent research report, the Toothville is effectively controlling the respiratory tract infection, especially the streptococcal infection. So 10 gram of this Toothville Lehium twice a day is very good, safe, effective preparation. These are all some Siddha preparations, some Siddha prepared medicines useful for the strep throat. So even though we see the management and prevention, it is very important to ask a question when to see a doctor. A sore throat accompanied by the tender swollen lymph node or lymph glands. We need to see a doctor immediately. High grade fever, a sore throat accompanied by the rashes. It is called the scarlet fever. We need to see the doctor immediately. The problems in breathing or swallowing or lack of improvement even after 48 hours, we need to see the doctor immediately. So at this juncture, I stop my presentation. If you have any doubt, we can discuss. Thank you.